Hello everyone. Today we will discuss some more points about the circulatory system, right? Today we will discuss about the portal system. Right? What is that portal system? For example, when you have to change just your network of your number, not particular that number or sim, because it is distributed in to per number of peoples, right? Then what we'll do, we'll go for just for to do portal clear to portability of the that particular sim, right? Same as that in our body, that portal system is just switching of the network, right? It's just like switching off the network. That means it is a system when the vein of any organ pour their deoxygenated blood through the other organ's vein, right? That is called the portal system. And remember, always portal system is always formed by the veins, right? It is always formed by the veins, right? Portal system is always formed by the veins, not by the arteries. It is not formed by the arteries, it is always formed by the veins. That is a question of pre-medical. Okay, so what is portal system? When the vein of any organ of the body does not open in the caval vein. What is that caval vein? Caval vein, that is the inferior vena cava and the superior vena cava, right? Inferior vena cava and the superior vena cava, and we know that the inferior vena cava is the longest vein of our body, right? Inferior vena cava is the longest vein of our body. That is a question of pre-medical. Clear? So the when it opens into that caval vein, that is the superior vena cava, and that superior vena cava which carries the deoxygenated blood from the head and the neck region and pour into the right side of the heart, right atrium, right? And from inferior vena cava, lower part of the whole body, right, from that all over the part of the body, inferior vena cava collects the deoxygenated blood and pour into the right atrium, right? So in caval vein or heart, but it divides into the capillaries in any other organ, and its blood transported by the vein, right? Its blood is transported by the vein of the other organs to the heart. Clear? So this is called the portal system. When we talk about that portal system are of three types, right? They are of three types. First one is the renal portal system, that is these capillaries enters inside the kidney and divides into the particular vein enters inside the kidney and divides into the capillaries, right, and complete the functions. Second one is the hepatic portal vein, that is hepata word is used for the liver. So hepatic portal vein, when that vein enters inside the liver and divides into the capillaries, and after that it comes out of the liver and form the hepatic vein, right, it forms the hepatic vein. And what will happen, that hepatic vein opens into the inferior vena cava, and that inferior vena cava carries that deoxygenated blood towards the heart, that is the right atrium, towards the right atrium, right, when and from right atrium to right ventricle to going for the oxygenation of the blood through the pulmonary artery to the lungs, right. So, and third one is the hypophyseal portal system, right. Third one is the hypophyseal portal system. So these are the three types of portal system. These two types of portal system are present in the frog, right, but that renal portal system is absent in the mammals, especially in the human beings, right. In mammals, specifically in human beings, only hepatic portal system is present. Clear? Only hepatic portal system is present, and that hypophysis word is used for the pituitary gland, right, and that means that vein enters inside the pituitary gland and divides into the capillaries, right. So this kind of portals, this is called the portal system, and remember that portal system is always formed by the veins, right. I am not talking about the portal triad, which is the combination of branch of the hepatic artery, hepatic portal vein, and the hepatic duct. I am not talking about that triad, I am talking about the portal system, right. So remember that portal system is always formed by the veins, not by the arteries. Okay, now come to the spleen. As we know that spleen is the reddish purple in appearance, and it is present at the lateral surface of the stomach, right. That is the stomach, right, and lateral surface, on lateral surface a reddish purple spleen is attached with a mesentery, right. Spleen is attached with the mesentery, that is a type of connective tissue which connects the spleen, right, at the lateral surface of the stomach. Clear? So that is the spleen. Why it is reddish purple in appearance, and in most of the cases reddish? Because actually that spleen is the largest lymph node of the body, right. Spleen is the largest lymph node of the body. When second one is, it is called graveyard of RBCs. That means after the destruction of the RBCs in the liver, the dead body is buried in the spleen, right? That's why it is purple in color. Just imagine when we have an injury by pressing by pressing or by crushing sometimes, right? But when that suppose that part of hand comes inside the margin of that particular door, right? But just is suppressed, it's not bleed, it's not like that, right? So it's just compressed here. So what will happen, there is bluishing, right? There is appearance of the bluishness, that is the bluish appearance, clear? So what will happen in that case, that blood vessels injured, right? What will happen, they endothelium, we know that the most regeneration power is present in the epithelial and the connective tissue both, right? So it can regenerate and gradually that bluishing disappears, right? But correlated with that, when small injury, with the small injury the bluishing is appeared, then when the number of RBCs are dead here, then what will happen, it changes the color completely of the spleen, right? That's why the spleen is reddish purple. Reddish, why? Because it is also known as the reservoir of the RBCs, or we can say it is known as the blood bank of the body, right? It is known as the blood bank of the body. Clear? It is known as the blood bank of the body. So it's largest lymph node of the body. Clear? Why it is called lymph node here? Actually, that spleen also helps to make the immune system strong, right? Graveyard of RBCs, because of the RBCs buried in the spleen after the destroying, and blood bank of the body. Why? Because it stores the immature RBCs, right? And when our body required the amount to increase the amount of RBC, then it release it into the circulation, right? So what will happen now, that spleen is originate from the embryonal mesoderm. Clear? Actually, it is also called the largest reticuloendothelial tissue in the body. Clear? Largest reticuloendothelial tissue in the body. So what will happen, it has two kinds of pulps actually, right? Spleen has two types of pulps. First is the white pulp and second is the red pulp. White pulp carries number of WBCs, white blood corpuscles, that's why it looks like the whitish in appearance, right? And red pulp carries a number of red blood cells, right? That is RBCs. That's why it looks in appearance red, right? Specifically, when we talk about that red pulp, there is present cord of Billroth, right? Cord of Billroth, they are the bigger sinuses. They are the big blood sinuses, right? That means they are the big pores. Sinuses, that means the pores, right? So this is all about the spleen. Actually, these cells, phagocytes, these cells acts as a macrophagic cells. These cells acts as a phagocytic cells for the dead cells, dead bacterial cells, dead RBCs, all these things, toxic substances, right? So we can say that spleen is also helps in the purification of the blood, right? Now come to the disorders. In disorders, first one is the hypertension, right? In general language, you know it as the high blood pressure. So how can we evaluate that the BP is high or low? Because we create a standard criteria, right, that the BP is not more than that in systolic and not more than that in diastolic, right? So simply when the blood pressure is higher than the 120 by 80 mm of Hg actually, but when it is theoretically, but when we correlated with practical cases, so we can consider it by 130 90, right? But if it exceeds from that, that means systolic pressure exceeds from 140 mm of Hg and diastolic pressure exceeds from 90 mm of Hg, then we can call it the hypertension or the high blood pressure, right? There is lot of reason for that hypertension or the high blood pressure. Maybe the person is in the stress condition, right? Or maybe its arteries, some triglycerides are deposited over here, right? And due to the deposition of that triglycerides, what will happen? The passage of artery for the flowing of blood is get reduced, right? So when the blood flow inside the arteries, it exerts a pressure over the wall of artery, right? It exerts a pressure because when the blood flow forcefully, right, and did not get the sufficient space or sufficient and comfortable path for the flowing, right? So what will happen? It exerts the pressure on the arterial wall, so BP will be increased. But continuously, if a patient has suffered from high blood pressure, but continuously its BP is maintained at a high criteria, right, that it damage the other organs also, like the kidney, right? So what will happen in case of hypertension? It is harmful for the other organs also, like the kidney and the brain, because we know that kidney filters the blood, right? And if the blood pressure is high, then the blood hydrostatic pressure will be increased, and if the blood hydrostatic pressure will be increased, then the net filtration pressure will also be increased, right? We will discuss it in the excretory products and their elimination chapter, these excretory, how the kidney work on it, right? What is that blood hydrostatic pressure, what is the net filtration pressure, right? So due to that, kidney to maintain the osmolarity as well, to maintain the blood pressure, the kidney works increases gradually, right? And it damages the tissues or renal tissues, right? And it cannot be regenerate after the loss, right? So simply, and same as that, when we talk about the brain, so when the pressure in high blood pressure is maintained, and we know that the capillaries inside the brain, they are very fine, right? And if the pressure is so much high, so it affects the brain capillaries, and maybe if there is any rupturing in that case of the capillary, then what will happen? The patient will be suffer from the brain hemorrhage also, right? So to avoid these consequences, we have to manage or we can say we have to take the management for the hypertension or the high blood pressure, right? Second is, and yes, one more thing, the reason of high blood pressure, that deposition, right, it is known as the atherosclerosis. Atherosclerosis, right? Actually there are two terms, that is, one is the atherosclerosis and second one is the arteriosclerosis, right? And both are differ, but NCRT considered as the same, right? So you just have to memorize right now that one, that is atherosclerosis. In NCRT it is given in the last page of the circulatory system, right? It is given in the last page of the circulatory system, that is the page number 288, right? Page number 288 in CAD portion. What is CAD? That is coronary arterial diseases, right? The full form of CAD is coronary artery disease, right? In that section, NCRT described the atherosclerosis, that is the atheroma. Atheroma, what does it mean? That is the plaque, this kind of plaque. Actually, it is the narrowing of the lumen of artery due to the deposition of the triglycerides, right? Due to the deposition of the triglyceride substances, that is the narrowing of the lumen of the artery. Clear? What is the atherosclerosis? That is the narrowing of the lumen of artery, right? That is called the atherosclerosis. But in NCRT it given as, in NCRT it given that it is due to the deposition of the calcium, the fat, the cholesterol and some fibrous tissue inside that artery, right? What will happen here? That is due to the deposition of calcium ions, cholesterol, fat, fibrous tissues, right? That is the exact line of NCRT in case of the coronary arterial disease, that is the atherosclerosis, which is given at page number 288, right? But listen carefully, actually that atherosclerosis, when we medicos talk about that, then it is just due to the deposition of the triglycerides. It's not actually cholesterol. That is the myth of the millennium, right? That is the myth of the millennium, and it is proved that by the scientists, right? So cholesterol is not not having the tendency to deposit it or to stuck the walls of the arteries. The triglycerides have that kind of tendency. So these are the triglycerides which are deposited over the wall of the artery, right? And due to the deposition of the calcium in the wall of the arteries, that condition is called the arteriosclerosis, right? In which there is hardening of the arteries. So when we see that there is a little bit difference in the arteriosclerosis and the atherosclerosis, right? For one is the narrowing of the lumen of artery and second one is the hardening of the artery, but according to NCERT both are the same, right? So you just have to learn this statement, right? that is the narrowing of the lumen of artery due to the deposition of the calcium, iron, right? Calcium, iron, calcium, iron, cholesterol, fat, and the fibrous tissue. Clear? So this is all about the hypertension and the coronary arterial disease. Now what will happen? We talk about the second one, that is the hypotension. Hypotension, that means hypo, that is decreased than the normal, right? Hypo, that is decreased than the normal. So what will happen? It is, in general language you can call it the low blood pressure, right? You can call it the low blood pressure. Hypotension, that is the low blood pressure. What will happen if the blood pressure reduce than the 100/60, right? Or we can say 110/70, it is reduced than that, or 100/60 is the lower range, right? So it is called the hypotension, right? It is called the hypotension. Now what will happen? Right, so this is the hypertension or the hypotension. Now we will discuss about that. We know that the causes of the hypertension, right? What are the causes of the hypotension? Why the blood pressure gets low? It may be due to some maybe it's momentary, right? Or due to the imbalancing of the electrolytes, right? It may be due to the persistent vasodilation of the arteries, right? And arteries did not get its actual diameter, right? Then what will happen? The flow of blood get gradually slow. Clear? Reduced ventricular pumping. So these are the causes of the hypotension or the low blood pressure, right? Now come to the, actually that name of the disease is not given in the NCERT, but yes, it's little bit the given diseases is related with that, right? We come to the ischemic heart disease, right? We'll discuss now about the ischemic heart disease or ischemic heart diseases, right? What is that ischemic heart disease? If the lumen of any of the coronary artery, right? Coronary arteries are the arteries of the heart itself, right? Which supplies only the heart. So if there is any obstruction in the coronary arteries, like the deposition of the triglycerides, right? And in general language, the cholesterol deposition inside the coronary arteries, right, or the cardiac tissues. So it enters in a condition where the where our body demands more and more oxygen. Why? Because due to the deposition the blood flow is affected, and if the blood flow is affected, then what will happen? The oxygen supply is also affected, and our body, now what will happen in that condition? The demand of oxygen will be increased, right, and supply is reduced in that case. So the stimulation goes towards the heart to supply more and more oxygen, and due to that stimulation our heart needs to do more work, right? And due to that sometimes patient suffers from the angina, right? Patient suffers from the angina. In general language you know it as chest pain, right? That angina, chest pain, due to the hypoxic condition, or the hypoxia, that is reduced amount of the oxygen, right? So what will happen in that case? If that condition is maintained here, and if that condition is not treated by the medicines, or will not treat that, then what will happen? We will go for the CABG, right? The full form of CABG, that is coronary artery bypass grafting, right? What will happen? This is the artery and the obstruction is here, suppose, right, which affects the flow of blood. There is a plaque deposited inside the wall of the arteries. Then what will happen? To reduce the consequences of that deposition, we will form a bypass here, right? Like that. So the blood flow is that path also, clear? That is the coronary artery bypass grafting. Now come to the next, the myocardial infarction, right? The myocardial infarction, or which is called the heart attack, right? When to compensate the demand of oxygen, our heart need more, and our heart working continuously, right, and more work, then what will happen? If the pressure increased suddenly, then it may be it damage the internal cardiac tissue, which cannot be regenerate after the recovery, right? So that is called the heart attack, right? That is called the heart attack. First symptom is the angina, right? So we can say in NCRT it is given in 288 page number in the heart failure reason, right? Just a single line regarding that is given here. When the heart muscle damage suddenly, right, by inadequate blood supply, this is called the heart attack, right? This is called the heart attack. When we compare it with the heart failure, there is difference between the heart failure, heart attack and cardiac arrest, right? Heart failure. What is that heart failure? Heart failure, that means it is the state of heart when heart is not pumping blood efficiently, right? Or we can say effectively enough to meet the needs of the body, right? We know that the function of heart is the pumping of blood, right, and supply the blood to all over the body, and when the blood supply is effective or sufficient, then the oxygen will be oxygen supply is sufficient, right? So that's why if heart is not able to do work properly, that is the pumping of the blood, then what will happen? Our body cells deficient in the oxygen, right? And if the oxygen supply will be reduced at the level of cells, then the cells will die and they cannot be regenerate in that case, right? So that's why heart failure, that is the failure of the engine of your body, right? Heart is an engine of our body which supplies the fuel, right? Which is responsible for the supplying of the fuel, right? If we will not get the fuel properly and sufficiently, then we will not be able to do work. Clear? So that is the difference between the heart attack and the heart failure. Now come to the next, that is cardiac arrest. Correlated with that name, cardiac arrest, that means what? That means arresting of the function. That means what is the function of the heart? That is the beating, right? When the heart stops beating completely, right? That condition is known as the cardiac arrest. In NCERT, actually that short definition is given to you, right? There is some differences in technical medical definition, but you have to just learn these lines just because of it is given in NCERT, right? So what is cardiac arrest? When heart stops beating, right? That is called the cardiac arrest. And if in that case, what will happen? If we know that it's gradual process, actually sometimes, right, we know that our cardiac tissue gets damaged after the heart attack, the efficiency of heart gets reduced, right? Will not be able to do work as previous. So what will happen? If we know that the cardiac tissue strength get reduced gradually day by day, right? And there may be there will be the chance of the second major attack, right? So what will happen? We have to be careful for that. And if doctors prescribe that and doctors observe that the heart is not in good condition and there is necessary now for the transplantation, right? So what will happen? The doctors suggest for the heart transplantation. Clear? When we talk about the world's first heart transplantation, the world's first heart transplantation was done by the Dr. Christian Barnard. He is the head of that team, and that first heart transplantation was did by the 30 a team of 30 doctors, actually, which is headed by the Dr. Christian Barnard, right? But when we talk about the first heart transplantation in India, it was done by Dr. P. Venugopal in AIIMS, Delhi, right? First heart transplantation of India occurs in AIIMS, Delhi by Dr. P. Venugopal with his team, right? On 3rd August 1994, right? So this is all about the body fluids and the circulatory system summary, right? It's just a summary.